Okay, so good afternoon, and thank you to the organization, Jonathan and Caroline, and everyone on the European Health Property Network. And thank you to Jeffrey and Peter for these outstanding presentations. I think you're going to see another point of view, more like architectural project. And this is, I'm going to present to you this emergency hospitalization project facility. It's a project that it's still going on, but I'm going to present where we are now. First of all, I'm going to explain what was our experience in COVID-19 during the first days, the first weeks. Then what's the decisions that have been made on the Catalan health system, and then what's the project about. So I'm going to start with a quote, an old quote, more than 100 years old, from Florence Nightingale. The very first requirement in a hospital is that it should do the sick no harm. So what was our experience in COVID-19? We got a call on March 21st from the medical emergency system, from the Catalan health system. And they wanted us to prepare 200 ICU beds in 10 days in some spare spaces that were in the General Hospital of Catalonia, which is a general hospital located 10 kilometers away from Barcelona. And these spaces were, for example, simulation areas, dining room areas. This is the layout of the dining room areas, and where we located these ICU beds. It was a challenge for us. It was a challenge for lots of people. This was a really strict lockdown. I think everyone was very scared, and no one wanted to move from their homes. So it was difficult to find people that were really committed to these works, but it was a group of companies and people that we were working there 12 hours a day, 7 days a week. I mean, there was no difference between a Monday and a Saturday. We had to do, it was our duty to do these ICU beds, to prepare them. So we had to look what we had on stock, what were the materials, what we could have in one day, in 10 hours. And we were doing just like the project was done day by day, with sizes, with what we had, what we could have. Also working with engineers for all the medical equipment. So this was set, and this was certainly these beds were occupied only 20 beds out of the 200, but it was an experience for us. And we had some learnings that it helped us to develop the project representative. What was decided from the Catalan health system network, CatSalut, after the first wave, it was that we are building, actually they are built up right now, 5 polyvalent hospitals that are satellites from general hospitals in Catalonia. And also from the medical emergency system, they decided to develop an emergency hospitalization, an emergency facility. This is not a COVID project. It was born from the COVID, but it's a long-term project. It's a country project. This project is we want to be prepared for a pandemic. We need to be prepared for pandemic, for natural disasters, for human disasters, and being more positive, for example, improving needs that we may have. If, for instance, there's a big renovation that wants to be done in a hospital, we don't need to reorganize all the hospital so the activity doesn't stop or doesn't lower. we can have this temporary facility outside of the hospital, move people, move patients, do the renovation, and go back without having to change all the organization. So the project is this, it's called Emergency Hospitalization, and it's an assembly of 70 to 100 beds that must be assembled within 70 to 120 hours for convalescent patients of any disease with low criticality and without complications. This project is based on 3 main concepts from an holistic group look. It's a standardized system with an emotional process and with a rational process. The 3 of them are equally important and we cannot miss any of them. Let's see what do we mean for a standardized system. We need versatility, we need flexibility, and the speed of response. We've been working in this, the adaptability with some modules, and the aggregation of these modules allows to grow in both directions, in X and Y, and we can add, we can grow with different aggregations or even with different shapes. Being the yellow group where the patients are, and being the pink group where all the supports are. For the flexibility, we have used some modules, which are 2 modules of 2.5 meter high and 0.5 meter and 1 meter wide. With these modules, there are existing, these are like panels that exist right now. We are not inventing anything. We don't want to invent anything. We need to use what we have right now. We can, with these 2 panels, we can structure and we can build the boxes for rooms, for bathrooms, and for all the spaces that are needed for these emergency facilities. The speed of response is equally important, and we need to find industrialized systems. For example, for instance, the facility must be ephemeral architecture. It needs to be lightweight, needs to be prefabricated and modular, easy to assemble, and that can cover large areas. A lightweight construction, we are using a stand system. This is the fair stands are studied, are developed. We don't want to, we need to use what has already been proven that it works. And we have developed what we call Life Kit. It's like an equipped cabinet that is used for one user, for one patient, and it has everything that it's needed in this kind of hospitalization. So we have all the installations incorporated, we have oxygen, we have electricity, ventilation, also the nursery call, light, like general light or breathing light, and also some space for personal belongings. And we need also the logistics and maintenance. Everything needs to be controlled, all the processes. So when the emergency calls, everything needs to be prepared to get it out of the warehouse, to build it, to assembly, and then going back to the warehouse when the operation is done. What about the emotional process? I think this is what we have missed during the first wave. It was okay. We did what we could, but we need to improve. I think it cannot happen that we missed all the emotional process. What do we mean by emotional process? We are building healing spaces, and these are based on neuroscience and evidence-based design. We work with neuroscience, and applied to architecture is what we call neuroarchitecture, which is a science that studies the relationship between the built environment and the human brain. So how people react and behave depending on the space they are living in, And this gives us this scientific evidence, when then we can develop the projects and not just doing things because we think they are okay, but because we know they are okay, because people are living there. We talked about natural light, artificial lighting, about colors and proportions, how important are proportions on space, about bringing landscape, bringing nature and green inside, about the natural ventilation and indoor climate, about acoustic comfort. We talk a lot about it, but then it's really difficult to make it real, about the contact temperature, surfaces, textures, smells, security and privacy, wayfinding and information. How important is that we feel oriented, or that we don't feel disoriented, and people get confused. So there are lots of studies that that relate this aesthetic quality, these concepts that connect the space with the emotional state, with the brain, and this can happen. The willingness to help, for example, or collaborate, the type of value judgments that are made, how we feel, the comfort or the discomfort. We need these facilities, these temporary facilities, to be flexible. We don't know what's going to happen. We don't know what's going to come. We don't know about COVID, but we don't know what's going to come in 10 years. So this is a long-term project, and spaces need to be flexible. So with these modules, we need to open our mind and see what's, without knowing what's going to happen, the spaces must be flexible. Privacy and intimacy. This from the first images you've seen, there was no privacy, there was no intimacy, and I think this is a human right. It's not difficult to put just some panels, so you can get like your own corner, your own space. Even if it's an open space, you don't see the person who is laying next to you. You feel comfort, you feel embraced with this within this space. The security, another important value. I think during the pandemic, no one wanted to go to hospitals because it seemed that when you enter the hospital, you would be contaminated or something. So the security, we need to plan these facilities with all the circulations. Everything needs to be planned, but also we need to transmit this security. People need to be feel safe. Staff, patients, and companies. And what about the improvements we can have in the spaces? This could be a temporary facility. It's okay. Great panels. This is what we have. Not a problem. This is better than nothing. But what if we bring some nature inside with some photographies? Why don't we put some wood panels? They don't have to be wood. They can seem wood. Why don't we put some natural light? And if it's not possible, bring in artificial light with the circadian circle that can help people to not stop your functioning, your natural functioning. Why don't we put some furniture with natural colors, with natural textures? And what about staff? The same. Staff need to work in the best space. We need to take care of them so they can be with patients and give the best of them. So let's have some nature, let's have some positive pictures, let's have some natural light and the best area to work on. And at the end, the rational process, as important as the other two ones. We are working in a cyclic process. So this is, we have the first, we are having the manufacture, but then we enter in this cyclic process that has the first assembly when the emergency is calling, then the operation and maintenance while it's needed, then the disassembly, the repair, because probably lots of things, lots of elements, equipment will need some repair before going to storage warehouse where custody and maintenance is needed as well. So when the cycle starts over again, everything is set so that it can be assembled in this 72 or 120 hours. The functional program needs to be studied as well. We don't know what's going to happen, but at least we have the areas. We can control what's going to happen on the patient area, and we need to control the entrance of people, staff, and all the supplies. And we need to control as well the exit of also the all the elements. About depreciation and budget, these I have no slides, but we are working now on the budget. It's not a normal budget. We need to do some economic plans, the amortization over time. How many times can we use these facilities over the time? How many times are the materials able to resist the equipment, the reparation? So what's the investment return? We need to look at the short and long term and planning the security. So I think I have time to show you just a short video. Let's see if it works. This is how we imagine this temporary facility structure. We want to avoid the first images we saw at the beginning of the presentation. It's a matter to think about now. It's not increasing the budget, but it increases the value of the facility. So just about materials and light and functionality and security. And I think we have the duty to build the best healing spaces, even if they are emergency and temporary structures. Thank you very much for your attention. And here you have my email in case you have any doubts or you want to talk with me. Thank you very much.